Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video, is missed by anybody.
Right, guys. So welcome to this case discussion tonight. We're going to be discussing anemia and pregnancy, a very, very important topic, especially in the Indian subcontinent. And this is the reason why you will not find very great guidelines over it, because it's almost oblivious in the Western world, but very, very rampant in Indian subcontinent. So the best guidelines you'll get will be the Indian guidelines, right? So this is again made up from the Indian guidelines, and I welcome everybody, especially Shilu, Shvelati, as well as Pavitra, who are the case presenters today, to discuss this case. And it's going to be a batch effort like it always is. Okay, everyone is going to be answering, everyone will be thinking, and the lead will be taken by these three girls, but they're not alone. My class is going to be there to support them. It's a combined approach. All of you are going for the exam. Anyone can have anemia and pregnancy. So please be mindful of every question that I speak. You should know the right answer. And even if you don't, this is the time to practice. All right. So I begin with the case discussion, and I invite Shilu to please start with the case. So yes, Shilu, here is your case in front of you. You can start.
Good evening, everyone. So this is a case of Mrs. Khushbu, wife of Gulshan Kumar Yadav, 23-year-old, education 10th pass, homemaker, married since 4 years. She is an unbooked case of our institute. Her parity is G2A1. She had a history of 2.5 months abortion, but that was spontaneous, followed by dilatation and evacuation done 2 years back. Her menstrual history was regular for 3 to 4 days with a cycle of 28 days. Her LMP was 2nd November, and her expected date of delivery is 9th August. So as per today's, her gestation age is 37 weeks.
All right, Shilu, a couple of things I'd like you to speak over here or just erase from here. First of all, when you're saying she's second gravida, previous one abortion, there is no need to give any detail of the abortion right over here. Neither do you really require to give a menstrual history. You can only just briefly say, like I always ask my students to say, just about that she was having regular menses. Because when you ask a patient when was your last period, at the same time you ask her whether your periods have been regular or not, because you're now dealing with her EDD. So unless her periods are regular, you cannot make her EDD the way we've been, taught by the formula. So at the very outset, what you usually do in your OPD, you do the exact same thing in the exam. So there's no need for a complete detailed history. All I need to know is that she's second gravida with a previous abortion. I'll be dealing with it in obstetric history. And her LMP is so-and-so with regular periods, making her EDD so-and-so. And her gestational expected gestational age are 37 weeks currently. All right, that's how you will speak. That's all. All right. Yeah.
So she landed up in our emergency with complaint of dizziness, generalized body weakness, with swollen limbs, both hands and legs for past 3 months, associated with body pain since 1 day. So she was.
So what are you thinking right now? What is thought process coming in your mind, Shilu? What could it be? She's coming in an emergency, a 37-weeker. She's feeling dizzy. She's having swollen limbs, and she's having body pain. These are all very vague complaints, isn't it? But dizziness is important to me, right? So dizziness, generalized body weakness, again, very vague. Swollen hands, legs, most of the patients with pregnancy have that. Body ache, again, non-specific. So what is it like telling you? Anything that is coming in your mind?
Dizziness is mainly maybe because of she's hypoglycemic. Maybe her, if we go in detail history, then we can find out that maybe because she is going into
I will ask you the detailed history.
So she's 37, so maybe she has having any congenital heart disease also, because dizziness can cause heart disease as well as hypoglycemia or any other abnormalities associated past medical history. She might have,
like,
she's not aware of, or she never evaluated about it.
Like, what are you thinking?
Maybe she is a case of like chronic anemia, which is not even ever get tested or evaluated before.
Yes. So see the most common things first. So mostly she's coming in an emergency with complaint of dizziness. That means we have to take her seriously. Okay. If you're working in a government hospital, all these patients will be taken. Either they are feigning it. Absolutely, they are. They like to come to the hospital very often. They're usually having the survivors of domestic abuse, so they want to get some sympathy, which is the tale of almost majority of the low socioeconomic strata problems. They're having some issues, they get the sympathy, they get attention when they come to the doctor, so they like going to the hospital very often. But most of them have also got another spectrum, is that they only come when it is dire emergency. So she's coming to the emergency with complaint of dizziness, and other things are absolutely vague. So right now, the only thing that's coming in my mind is something acute. Maybe if I ask her more, maybe she's having some internal hemorrhage. Maybe there's a history of trauma. Maybe there's a history of chronic problems which has suddenly exacerbated. Could be a heart disease, definitely. Hypoglycemia, I do not, entertain much over here, because hypoglycemia can happen anytime in pregnancy. Must have happened before as well. Why suddenly now at 37 weeks? So I'm more bothered about something acute, especially internal hemorrhage, abrupt show, something like that. Maybe not revealed, concealed hemorrhage, something. But I want to know that. All right. So this is the things. There's a thought process going on in my mind. So these were the chief complaints. Now, yes.
So for presenting complaint, patient came in history of dizziness, generalized body weakness, swollen limbs with both hands and legs for past 3 months, associated with body pain since 1 day. So the patient was unwell when she got pregnant, but did not seek help until now. She has just 2 ANC visits in her 9 months of pregnancy. She complained of generalized body weakness and fatigue while climbing stairs. Her relatives noticed that she is unwell and bring her to the hospital. There is no history of abdominal pain, spotting for vaginal or urinary complaint, or passage of any clots. Sorry, ma'am. Clots. I just read it. Clots.
Yeah, no problem. It's okay. I'll correct it. Yeah.
Yeah. No history of any any discharge for vaginal or smell or history of fever.
Okay, so what are you anticipating? Why are you asking these history? Abdominal pain, I understand, because she's almost term pregnancy. You need to ask her about pain, bleeding, leaking, movements of the baby. But why are you asking about passage of clots, vaginal discharge, fever? Why?
Some infection can cause further, like if there is any history of leaking for vaginal, which can be a chronic chorioamnitis, or any further like for vaginal like discharge
It's
or
not
bleeding
related. Okay, it's not. I'll tell you, it's not related at all to this case of yours. Not at all. But yes, she's a term pregnancy. You can always ask these questions: any leaking, discharge, bleeding, how are the fetal movements, and then since she's having generalized body ache, fever is okay. You can ask her fever, because that could be leading to multiple causes. You see anybody who's having not even pregnancy, anybody with generalized body weakness, you feel what? First thing, what do you feel? She must be having some kind of disease. She's currently having some kind of infection, to be more specific. Yes. So there are so many infections which happen, viral infection, that you don't run a fever, you start feeling weak, or sometimes there is a prodrome of weakness followed by a fever. So this is a justified question. But the other questions like vaginal discharge, bleeding baby, there you can just club it as, ma'am, she's a term pregnancy. I just want to ask her basic general questions. Nothing to do with this. Okay, be very clear why you asking this question. Negative history, everything you're writing down and you're speaking in front of the examiner, make sure you know how to back it up. That's it. Okay, and if you're feeling that no, this thing will land me in trouble, erase it. Don't unless it's very important negative history, do not use it. All right. So this is her current feature. The very, very startling fact about it is that up till 9 months of pregnancy, she never had any antenatal visit. That's very strange. Even the very literate people nowadays, they do come up to have at least 1 or 2 antenatal visits. They take the iron tablets, the calcium tablets, get the testosterone injection. That much they do. And that too free of cost, but she never attended. Now she has come, and she was always unwell as per her relatives, isn't it? So the condition has deteriorated even further. So we have now, these are all red flags. So we have to now start thinking, what could it be? So what are you thinking, Shri?
I was thinking more of a heart disease that time when she came in the emergency, because it can aggravated at the third trimester is more compared to first or second trimester, as she never had any visit to the tertiary center or just 2 ANC visits for the tetanus toxoid vaccine. That's it. With the
Okay.
that ASHA local PHC, and that too she doesn't have any further like investigations, as we
Yeah.
noticed.
All right. So this is a very good, differential which she's thinking about. That maybe what she's very clearly saying, the patient was unwell when she was pregnant. So maybe she was already having some chronic disease, could be heart disease, could be some other maybe renal disorder or some other hypertension or diabetes, uncontrolled, because of which she was always having weakness. Now she's pregnant and nobody knows what exactly she's carrying, and now suddenly her condition has deteriorated even further. So just think in your mind what conditions can deteriorate in the third trimester, especially towards the end. Anemia is a very good answer. Heart disease is a very good answer. And anything which is called generalized problems is mostly these two. So she's right. The main focus right now is we are trying to delineate whether it is a heart disease, whether it is anemia which has gone bad, or any other chronic disease which has gone from bad to worse. All right, I agree. So now this is all over the history of presenting complaints. Anybody else would like to add to the negative history over here? And very important is Shilu, you have to write down the fetal movements here. History of fetal movements is extremely important when you are asking about history of presenting complaint. Whether
Perceiving
she's
of
come
fetal movement.
sorry?
Perceiving of fetal movement.
Yeah, perceiving normal fetal movements or perceiving fetal movements just fine. Okay? No history of leaking, bleeding, pain, that has to be written. Okay? And the other things that you, in your case, you can ask her that she's no history of any fever, no history of any bleeding. Yeah, so any other history that you think, guys? Okay, Shwelati will not be able to join us. She's got some okay, she's not been relieved by the group. Just a minute, guys. Let me see what are you guys writing down. Okay, never mind. Yeah, very good, Pragati. Absolutely, you can do that. We can ask her about any problem or difficulty in breathing. So she's already saying fatigue while climbing stairs, right? So here we can ask her, do you feel breathless? You're having fatigue, understand, but do you have breathlessness? Do you also have breathlessness in walking on a straight path rather than climbing stairs? Climbing stairs, many people can have. How many flight of stairs that could have been asked to understand her condition better? That's number one. Does she feel breathlessness on walking? Does she feel breathless on normal chores, or she starts feeling breathless only on walking the stairs? So do you have an answer for this, Shilu?
She was accompanied by her relative, so they just told that they see her like getting fatigue and breathlessness while climbing stairs only. That's why they get more worried about it, and they see that she's getting more deteriorated day by day as her pregnancy increases. So
and she's not feeling fatigue, she's not feeling breathless when she's doing her normal day-to-day activities,
normal
right?
day-to-day, no.
All right.
Only while doing her household works, like doing like stairs and all that, up that time they feel like she is getting very tired easily.
All right. Anything specific in menstrual history?
No, ma'am. Menstrual history is
so
regular.
No history of any heavy periods, right? That is what I want to know here. No history of heavy menstrual bleeding. Okay. Yeah. Over here, Shwelati, this thing is Shilu. Please don't write the menstrual history before you're talking about the history of presenting complaints. Don't do that, okay? First of all, history of presenting complaint, then history of pregnancy. That's how it goes, okay? Then once you're done with the entire thing, then you'll talk about the menstrual history, okay? Yeah. So history of present pregnancy, yes. Anything that you would like to tell us? Apart from what you've already told, that she's not had any antenatal visa, how can you say anything, right? Yeah. But anything which you are correlating with her current condition?
She didn't mention anything.
Ask. Nothing. Okay. So she is pretty ill-informed about herself. She's not taking care of her own self. Obviously, she's got no folic acid. She's taken no has she taken any regional? Okay. Has she taken any iron supplementation? No visit.
No, she just had an tetanus toxoid injection by ASHA and registered her, but she was not aware about any medications given by them. as they said it to visit her to PHC and she couldn't able to go there. So she didn't get any medication.
All right, no problem. So this is the problem with our current patient, that she's not been taking any iron tablets, nor has she got any tests done. So this is third trimester. She went to the PHC with this thing, generalized body weakness and dizziness. And here
So-
hemoglobin was done. This is the first time we are
Yes.
getting to know this is an anemia case. Okay.
Yes. First time it was done when she went to the PHC and it was revealed 6.7 gram%.
And how
And
in
her-
history, how do you know this?
It was written on the Mamta card. The Xerox copy when they bring to us, they usually bring the Mamta card to us. So in that Xerox, we see that there was a visit in the PHC where it is noted down the BP, the HB. That to be handwritten on, there was no lab, reports we got.
Okay.
Just it was
Guys,
handwritten.
are you all consistently getting the investigations in all your centers in DNB, final DNB exam? Is Usha there in the class today? Wait. Usha, are you there today? If she joins in later, I'll ask her. But do you have any input from your seniors, whether you guys have given any investigations in your exam?
No, ma'am. No, we don't get it.
So,
we just get the patient.
So let's just presume we don't have this investigation. Are we still thinking that it could be anemia, heart disease, or any other chronic illness? All right, Shilu? I'm just making it exam-like. So we don't have this answer with us. Third trimester, she went to PHC. She was diagnosed with something. And she's saying to you that, yes, I was diagnosed with something in my blood. That the blood is not up to the mark. Okay? Something like that, she said. Khoon kam hai, khoon ki kami batayi gayi hai, something like that. That my blood is, not up to the mark. All right. And she was started on Takat ki goli. That's what they say, isn't it? She was started on some medication to improvise her blood condition. All right. Nothing specific in marital history, but I'm seeing that she's 4 years, into marriage. So why was she into, 4 years and only one abortion? What is the history?
Her husband is not staying with her. He usually stays away from, she met her husband only in the weekends when he came back from the work. He usually go outside the city and work.
And she's staying with her in-laws.
Yes.
And then she's so neglected. All right.